cancer journal entry. I don't even know what number anymore, but we now have a PET scan. So we have PET scan results. We have also this week, that was Tuesday, and then Friday we met with a proton radiation guy. We are currently getting treated at one hospital under chemo, but they do not do proton radiation, and their radiologist, is that right? I don't know. Their radiation doctor recommended proton radiation because of the specifics of where my cancer is or where the tumor is. And we have now had that meeting with the proton radiation, which will be at another hospital. So lots of people on the team. But the PET scan, this was actually our first PET scan because since I started treatment in the hospital, they were not able to do an initial PET scan. All we had initially was CT, MRI, and the biopsy results. The PET scan, they didn't have a PET scan machine in the hospital, and so we just couldn't get a PET scan. So I actually had 2 doses of chemo before we got the PET scan. But the PET scan has shown that it is shrinking, which is amazing. The PET scan was really hard to understand in comparison to the CT scan size-wise of the tumor, and so much lit up, including the tumor. But then because I'm on chemo, all my bones light up right now because the bone marrow is working a lot, and so they're lighting up. So much was lit up. It was hard to understand. But the tumor is shrinking a lot based on what the proton radiation doctor said. We really loved him. It has shrunk, and based on what he's seen, 80 to 90%, which is amazing. And just really grateful for that. But there are still some tricky things based on the placement of the tumor. So both my chemo doctor, I will not do more than 4 rounds of chemo. I just finished my 3rd. I will be starting my 4th right after Thanksgiving. And I'm so happy to be only 1 treatment away from being done with chemo because chemo sucks. But it's helping, so I'm grateful. But per what my chemo doctor wants to do, 4 rounds of chemo, then radiation, whereas usually they would treat with chemo and radiation simultaneously, but because of, I've got to be unique. I always liked my uniqueness, not so much right now necessarily, but it's what they recommend is best. And then when we had our proton radiation meeting with that doctor, he agreed as well. So the issue now is what is left of the tumor is what is in the tricky, I guess the whole thing is in a tricky place, but it's in my eye. What is left of the tumor is still here in my eye, or not in my eye. It's behind my eye in my sinus cavities, but pressing on my eye, and it's sitting on my optic nerve. And that's the hardest. I assumed that would shrink first because the mass was here, like the main part of the mass, like the big, I'll try and show some CT scans, which can show the difference between our first CT scan and then the CT scan they took with the PET scan. And so you can see it's shrunk a lot. The main mass that was sitting in my sinus cavity and making it really hard to breathe, that's gone. Not gone all the way, but the radiation oncologist was able to scope my nose, which no one has been able to do so far. They were only able to get it like right up here. And then the mass was just sitting there blocking them from being able to scope. He was able to scope all the way down, get to my throat, which that was great. So the mass has left the main part of my sinus cavity. In the pictures, you can see what's left is the gray that's sitting behind my eye. And the way the radiation oncologist described it is that's the trickiest part for the chemo to impact, because the blood flow here, there's not a lot of like veins and blood flow. You've got your optic nerve, but there's less blood flow here than there is through your sinus cavities. And then the other tricky part was the reason they can't do surgery is that it's sitting somewhere in the back of like the sinus cavity back here. It's like really deep, past just under my brain. So it's moved from pushing off of my brain and it's coming out of that space, but that's what makes surgery basically not an option. And so, but the tumor that's still behind my eye is just less, or I guess it's more resistant to chemo because of the lack of blood flow there to help the chemo reach it and attack it. You learn new things all the time, apparently. But the hope is now I have an MRI scheduled for Tuesday. I was really hoping to push it out a little bit more just until after the 4th round, but the radiation doctor said really what he needs, it's fine to do the MRI now after the 3rd round, because that's going to be the biggest impact on how much it has shrunk and what he needs to see in order to be able to kind of move forward with starting radiation. So I have that on Tuesday. But the hope is, and the tricky part and the hope is that there's enough space between the optic nerve and the tumor. And he said millimeters matter and make a difference. So just prayers, vibes that even right now, the chemo's still in my system. So my chemo cycles are 21 days apart because the chemo kind of continues to work therapeutically for 21 days. And by the 21st day, it's basically no longer at a therapeutic element, which is why they start the next dose and start it again to get that built up. But just hope and pray that the tumor is shrinking enough away from my optic nerve that it'll make the radiation easier, better, because proton radiation is much more targeted than traditional radiation, which is why they'll be doing it for this, with it being where it is. But there are still risks. It's still radiation. It's still going to be going in through my eye. The way proton radiation works is the beam still goes in, but it hits the tumor and then it doesn't go out. Whereas with regular radiation, when the radiation goes in, it can also then bounce off and out, past the tumor that it's trying to attack. So I'm very, very, very grateful. When this whole thing started, we started looking into all kinds of therapies, integrative options, and proton therapy was just what we were really hoping, or we were going to look into if we could. And so then the fact that it was then recommended, and there is a proton, because there are not a lot of proton treatment centers, it's just becoming, they're just, most cancer institute, I think all cancer institutes have radiation, but not all cancer institutes have proton therapy radiation. And so I'm just so lucky and just grateful that there's proton radiation available where we are. And we would have traveled if we needed to, to another state, but we're grateful that it's here. And yeah, just trying to look for all the silver linings where I can. But I think I got off topic. Yes, proton radiation goes in, hits the tumor, and then doesn't go out past the tumor. So it's better for helping with not getting cancer from the radiation. There's still a risk of that, which, what do you even say about that? But baby girl's starting to move. She's doing so good here. She's gonna be really dark, but well, you can't see her. It's fine. And then the other big risk is the closer it is to my optic nerve, makes it really risky for the chances of losing my vision. He did say over time, so my hope is that would mean multiple years from now. But I've been dealing with messed up vision this whole time, and it sucks. I try to read. I can read things, but it's blurry. And then if I close this eye, it's just super blurry. I can read the words that are just like maybe a few feet from me, but anything past that, and reading them, I have to kind of discern what they are. It takes me time versus just being able to look at it and read it. And so I really would like to keep my vision as intact as possible. I would like to get my vision back to what it was. I don't know if that is going to be something that happens. It's supposed to be as the tumor continues to shrink and the pressure gets released off my optic nerve. That's what's causing the vision issues. So I'm having double vision if I look certain ways, and then otherwise it's just blurry. But if we can get the tumor to come off of my optic nerve and my optic nerve can heal, it's not like it hasn't damaged my optic nerve. It's just pushing on it right now. So it just needs to release that pressure to be able to allow me to get, it doesn't hurt. It just feels sore. So relieve the discomfort, and then hopefully my vision will return to normal. But overall, I'm just feeling, after Tuesday's appointment with my chemo doctor, I was just feeling really discouraged. The PET scan was so hard to follow, and it was just hard to understand, and I didn't want to have to do a 4th round of chemo, and it was just left feeling discouraged. Even though it was responding, it was hard to see how much it was responding and really understand the impact of that. But then Friday's appointment with the radiation doctor, he just explained things so well, and he was so patient focused, and I just really, a lot of it was hard to hear, but I just left, we left hopeful. My mom broke down, and she's been holding it together really well through this, and so it was a hopeful breakdown and one she needed, but she's breaking down. I'm getting emotional, but it was just because we really liked him. His name is Rafael Manon at Orlando Health, and he's wonderful. And my care team at Advent has been great as well. We've got a great team, but he was so explanatory in the layman's terms. Someone who's never had cancer, doesn't understand cancer, wants to understand cancer, and wants to just feel heard in the sense that it's a case-by-case basis. Yes, they have their protocols, and they're going to do what has worked for patients, through what they know. and the science that is backed by it. But he was just really open and, super explanatory, and took just time to sit, answer questions. I mean, we didn't feel rushed, and it makes a difference. So, having good doctors read reviews, that's 100%. We read reviews on doctors when we were looking at a difference between UF, I think, in Miami, and reading reviews is helpful, because one of them said, this guy really knows what he's doing, but said nothing about, patient approach or bedside manner. Whereas the other doctor, one had tons of reviews. The other guy had maybe 20, had tons of reviews, and they were all, he's amazing at what he does, but he's the most compassionate, caring, blah, 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 blah. All of those things. And so look into that. It's important. Having a team that you feel confident in is important. And so that's our newest update. I feel like this is just a big ramble, but it's shrinking. So that is amazing. That's the best thing. We just need it to go away. We need it to shrink and go away and not come back. That'll be a whole nother discussion, because we've delved into all kinds of, diet, lifestyle, which we have a pretty healthy lifestyle, but supplements, all these kind of things. And it's very overwhelming to keep it from recurring, and to help, any of the impact of the radiation that might cause a radiation cancer occurrence, doing all the things we can do to keep that from happening. And that's the stuff that just kind of makes me really, I don't know what the right word is. It doesn't keep me up at night, but in some ways it does. It's like, well, if I want to take a bite of a cinnamon roll, I'm like, oh, that's sugar. Don't eat it. But I also like food. So we're just trying to find that balance, and we're gonna get through all this, and then I'll, figure all that stuff out. But so I took a bite of the cinnamon roll. It was fine. It's shrinking. But it's just a lot, because, it's just all a lot, but we're doing it. I'm so thankful that it's shrinking, that it's responding to treatment. And so I'm just keeping moving forward. My sister keeps sending me affirmations that saying healing is within reach for me. And so I just keep speaking that out when she sends it to me. And then a Bible verse on the Bible app that I use that same day was all about healing, and he heals the broken and the wounded. Psalm 147 verse 3, I think. And so I've just been kind of trying to live in that and not in my doubts, because sometimes I try to stay there too. And, well, I don't try to stay there. I end up there, and I'm trying not to stay there. I'm trying to stay in the hopeful, and especially that it's responding. So that's our update. PET scan. We will have another PET scan after the 4th dose of chemo. Then the Proton doctor said there will be a break between the 4th dose and when we start radiation, but it won't be very long, because they don't want to give it time to grow back. But I am grateful for the break. That will mean that on Christmas I won't be on chemo. I won't be doing radiation. I'll be done with chemo by Christmas. So I'll be able to do Christmas without having to worry about side effects. They should be gone by then. And then we're hoping to take the few days after to take her in the camper for the first time and go camping. So I'm really looking forward to doing that. And just sitting by the fire with her, showing her why we love the camper so much, telling her that someday we'll live in the camper again with her, we'll travel, we'll see all the things. And so, no chemo by Christmas. All right, we're going to end here because I'm just rambling at this point. But till next time.